Breaking news. If you've been following the updates around the Department for Work and Pensions, DWP, and Personal Independence Payments, PIP, you're in for some really exciting news today. A new update could potentially see you receiving up to £812 a month for simply living with specific NHS health conditions. That's right, up to £812 every month. And guess what? These payments are available for anyone with one of 27 NHS health conditions, meaning thousands of people could qualify and not even realize it yet. Stay tuned, because today we're diving deep into what's going on, which conditions qualify, how you can apply, and all the crucial details you need to make sure you're getting what you deserve. Let's get into it. Alright, before we jump into the details of which specific health conditions are covered by this, let's first take a quick step back and review what PIP actually is. Personal Independence Payment, or PIP, is a financial benefit provided by the UK government to help people with long-term health conditions or disabilities cover the additional costs that come with their condition. If you're dealing with a chronic illness, injury, or disability that makes it harder to manage daily life, PIP is designed to help. You've probably heard of PIP before, but what's changed now? Well, recently there's been an important update to the list of health conditions that can make you eligible for higher payments. Now, these payments could be as much as £812 a month, and this could be life-changing for so many people who are struggling to cope with the costs of living with a serious health condition. Imagine being able to get financial help for your daily living costs, for mobility assistance, or simply to help you manage the day-to-day difficulties that come with these conditions. So, let's break it down for you. How does it work? There are two components to the PIP, the daily living component and the mobility component. Each of these components has three possible levels of payment: standard, enhanced, or zero. The enhanced levels are where we're talking about those higher payments, up to £812 a month. This is where it gets interesting because it's not just about your condition itself, but how it impacts your daily life. That's right, the more severe your condition is and the more it limits your ability to carry out day-to-day tasks, the more likely you are to qualify for these higher rates. Now, we all know how difficult it can be to live with chronic conditions. Whether it's battling fatigue, chronic pain, or mobility problems, your quality of life can be severely impacted. But this update means that if you're living with one of 27 specific NHS-recognized health conditions, you could be entitled to receive more support, helping ease the financial burden. And that £812 a month could make a huge difference. But the key question is, what are these 27 conditions? Who exactly qualifies? Well, the Department for Work and Pensions has published an official list, and today we're going through it. Get ready to check if you or someone you know qualifies for these payments. It's important, so listen closely, and let's go through this together. Let's start with condition number 1, chronic pain. Now, this is a big one. Chronic pain can be debilitating, and it affects millions of people worldwide. Whether it's from arthritis, fibromyalgia, or a past injury that never quite healed, if your chronic pain limits your ability to do simple things like walking, cooking, or even getting out of bed, you could qualify for PIP. Pain impacts every part of your day, and it's definitely something that the government is acknowledging as a major challenge. Multiple sclerosis, MS. MS is a condition that affects the nervous system, and as it progresses, it can impair mobility, vision, and even cognitive functions. People living with MS can often experience extreme fatigue, problems with balance, or difficulty controlling bodily functions. If you've been diagnosed with MS and these symptoms affect your daily life, PIP could help with the additional costs that come with this condition. Parkinson's disease. Parkinson's affects movement, and as the disease progresses, it can cause severe tremors, stiffness, and difficulty with balance and walking. If you're living with Parkinson's, especially in its more advanced stages, you might struggle to complete basic tasks that we often take for granted, like dressing, feeding yourself, or getting out of bed. This is another condition where you could qualify for those enhanced payments to help you manage those challenges. Next, let's talk about severe mental health conditions like severe depression, anxiety, and post-traumatic stress disorder, PTSD. Mental health conditions are often invisible, but they can be just as disabling as any physical condition. If you're living with severe depression or anxiety that limits your ability to work, take care of yourself, or even leave the house, you could qualify for PIP support. The DWP is recognizing that mental health needs special consideration, and these conditions are now on the eligibility list. Stroke victims. A stroke can leave lasting effects, including paralysis, speech difficulties, and memory problems. If you've had a stroke and it has left you with lasting physical or mental impairments that affect your mobility and daily living, you could be entitled to higher levels of PIP. Cancer. If you've been diagnosed with cancer and you're going through treatment or experiencing the after effects of cancer, PIP could provide critical support. Treatments such as chemotherapy or radiotherapy can have lasting physical and emotional effects, making it difficult to carry out daily tasks. Whether it's managing fatigue, pain, or the emotional toll cancer takes, the government has recognized the need for support for cancer patients. Moving on to COPD, chronic obstructive pulmonary disease. If you suffer from COPD, you may experience constant shortness of breath, difficulty walking, or even extreme fatigue. When these symptoms significantly affect your daily activities, PIP could offer financial help to manage these issues, especially if your mobility is affected. Number 8. Diabetes. Diabetes itself can be manageable, but if it leads to complications like nerve damage, vision problems, or fatigue, it can be much more difficult to live with. If you're struggling with these complications, you might be eligible for PIP to help you cope. Epilepsy is next on our list. Severe epilepsy with frequent seizures can disrupt everyday life and make it difficult to do simple tasks like cooking, crossing the street, or even socializing. If your seizures impact your independence, PIP could provide the support you need. Let's also include spinal injuries. These types of injuries can result in partial or total paralysis, chronic pain, or limited mobility. If you've suffered a serious spinal injury, PIP could help with the added costs of care, therapy, and everyday tasks that become much more difficult with this kind of injury. Heart disease is another condition where PIP can make a difference. People with heart conditions often experience fatigue, shortness of breath, and difficulty completing basic tasks. If your heart condition significantly limits your daily activities, PIP could provide crucial financial support to help you live with the extra challenges that come with it. Another condition to consider is chronic kidney disease. As your kidneys begin to fail, you may experience swelling, fatigue, and other issues that can severely affect your ability to move around or carry out daily activities. If you're dealing with this, PIP could help ease some of the burdens. And there are many more, such as motor neuron disease, severe anxiety disorders, dementia, cystic fibrosis, and even severe sleep disorders that could potentially qualify for these enhanced payments. If you or someone you know suffers from one of these conditions, now is the time to find out if you're eligible for support. So, how do you apply for PIP if you think you're eligible? The process is simple, but it does require some documentation. The first step is to fill out the PIP claim form. You can obtain the form directly from the Department for Work and Pensions, or you can request it by phone. It asks about how your condition affects your ability to perform everyday tasks. Make sure you answer everything in as much detail as possible. This will be crucial for your assessment. Once you've submitted your claim, you'll be invited to a face-to-face assessment with a healthcare professional. They'll assess how your condition affects your daily life and make a recommendation based on your level of need. This is where having supporting evidence, like letters from your doctor or specialist, medical records, and test results, can really help strengthen your claim. Here's a tip: be as detailed as possible. If you struggle with something, whether it's getting out of bed, preparing meals, or even just sitting for long periods, don't leave it out. The more information you provide, the stronger your claim will be. And remember, you're not alone in this process. There are plenty of resources available to help you through the application. Once your claim is assessed, you'll be notified of how much you're eligible for. If you're approved, you'll receive the monthly payment, which could be as much as £812 depending on your condition and level of need. And if you're not satisfied with the decision, you can always appeal. It's worth fighting for the support you need, especially when it could make such a huge difference to your life. So, if you or someone you know is living with one of these 27 conditions, don't wait. Check your eligibility, apply for PIP, and get the financial support you need to live more comfortably. It could be a real game changer. That's all for today's breaking news about PIP and these 27 NHS health conditions. If you think you might be eligible or if you have questions about how to apply, leave a comment below, and I'll try to help as much as I can. And don't forget to like, share, and subscribe for more updates on news that affects you and your loved ones. We'll be back with more information soon, so stay tuned.